Hi, good afternoon and welcome back. Today our topic is breast augmentation, breast lift, and maybe for some of you a combination of both. It's not uncommon for me to have a patient come to see me and want to have their breasts bigger and to have their breasts lifted. I know that they want to have them lifted because they'll frequently say, "Oh, well, gee, doctor, I want to have my breasts larger and perkier like they used to be, and I want them back up here where they used to be." So that lets me know that there's a real possibility that they may need a lift. If your breasts are small, you need an augmentation, and if your breasts are saggy, you need a lift. Now, fortunately, there's two fundamental ways that we can lift the breast. One is to use a large implant. What is large? Large is an implant that's going to be of sufficient volume to increase you usually about 2 cup sizes, 2.5 cup sizes even. And so, in my opinion, to accomplish that, we want to have an implant that is going to be the most natural looking implant. I like to use a breast-shaped implant to do that. My feeling is the larger that we go with an implant, the more that implant imparts its shape to the shape of the breast. And so if you want a breast to look natural, it makes a whole lot of sense to me to use a breast-shaped thing to do it with. So I like the breast-shaped implants. They're always going to be textured. As you can see, some people used to call this teardrop. Some people call this anatomic. I call it breast-shaped because it's shaped like a breast to go into the breast and make the breast look bigger. Now, there's another implant that we use with or without a breast lift, and the breast-shaped implant can be used with or without a breast lift. And this would be a round, smooth implant, very popular, arguably one of the most popular implants on the market today. My personal bias is a round implant, if it's big enough, is going to control the shape of the breast, just like a big breast-shaped implant would, and make the breast, in my opinion, look more artificial because it's not breast-shaped. So, just personal bias. There are plenty of plastic surgeons that would disagree with me, but that's what I think. I also don't like the smooth implants because I think they're too slippery. And if it's slippery means it can change position, usually in a downward direction, causing bottoming out and other complications like that that could have been avoided if we had used a textured implant. Textured implants have a higher coefficient of friction, which means that this is less likely to slide down because the surface of this implant allows a certain minimal amount of ingrowth from the breast structure around it, and so it stays in position a little bit better. Causes a slightly stiffer breast implant result, which doesn't have quite the same fluidity and movement and all that, but it also doesn't have the risk of positional changes and so forth. Okay, so we've established that if you have some sagginess of your breast, now when I say sagginess, let me define that as breast resting on chest. Okay, so if this is your breast, and well, let's do it this way. If this is your breast and this is your chest and you've got breast actually touching, then that's sagginess. That's what we call ptosis. We use the word ptosis in the medical profession. Ptosis is spelled with a P. The P is silent. It's P-T-O-S-I-S, ptosis. So if the breast is resting on the chest, then you have sagginess. That can be mild or that can be moderate or severe. Now, mild sagginess of the breast can be corrected with a large enough implant. I think we touched on that a minute ago. Now, how do I know if a large implant is going to be sufficient or not? Well, we've come up with a pretty good measuring system that allows us to know with relative certainty whether or not a large enough implant is going to be big enough, wide enough, deep enough, tall enough, big enough to inflate that saggy breast skin envelope we talked about and relieve you of that ptosis, that sagginess, that breast resting on chest business we talked about. So what I've realized is, okay, if we draw a little line underneath the breast, right there in that breast fold, and then let the breast hang with the lady in the standing position, natural standing position. And then we take a little flat edge and put it right up against the bottom of the breast and draw another line. Now we have two lines, right? One is that breast fold line. The second is that breast, the word is tangent. That's from, I guess it's what? Algebra? Something like, anyway, tangent line. So now we can measure the distance between the breast fold and that lowest point on the breast curve when the breast is in the normal resting state, arms at your side. And if that distance is greater than 2 centimeters, which is about an inch, then most likely you need to have a breast lift where we're subtracting skin. Now, a lot of patients will come in and they'll know they're saggy. They may not know how severe it is, but they're hoping upon hoping that a breast augmentation is going to lift them. And you know, if they've got significant sagginess, and we said 2 centimeters is our cutoff. We have patients coming in here 4, 6. The biggest I think was like 11 centimeters, which is like really saggy. And you know, they need to have a lift. Now, a surgical breast lift is a skin subtraction procedure, which means there will be scars. And a lot of patients have a lot of fear about scars that come about from breast lifting. I have spent a lot of time and diligently pursued a surgical solution to the scar issue and have been able to incorporate principles of geometry into the breast lift procedure that I do that minimizes scar appearance. In fact, it is common, not the exception, but it is commonplace, if not the rule, that patients that have had breast lift surgery with us, you know, three years prior, and certainly by 5 years post-op, have scars that are difficult to see. They're, in essence, imperceptible. Of course, if you get close enough and stare, you know, and get, you know, so you're going to be able to see a scar. But the point I'm making is these are not loud, glaring, raised, dark, you know, obnoxious-looking scars. So we don't need to worry about scars too much. So if you're small, you need to be augmented. If you're saggy, you need to be lifted. Some patients will need both. There are small subset of patients that have breast augmentations already who have sagginess that want those implants removed, and they may just want to lift or a smaller implant. So there's lots of variations on this. I hope that this information has been helpful to you. Have a great day.